Okay, so now that the patient has been intubated, we're going to go ahead and start our pre-surgical scrub. First thing I'm going to do is express the bladder. So I have my here. And her bladder is actually empty, so that's good. That means their bladder won't be in the way during her surgery. She is having a stay, so she's in dorsal recumbency, so that's the position she's going to be in during her surgery. So first thing I'm going to do is I'm going to get my gloves, and I'm going to shave the abdominal area. Working with here, I want to make sure that it's symmetrical, more so for the client. And next I want to take my vacuum and vacuum up all the excess hair. And next we are going to move on to the scrubbing process. So now I'm going to do our pre-surgical scrub. First thing I'm going to do, I'm going to take my chlorhexidine and a water solution. I'm going to wet a gauze with it, and I just want to wet down these hairs on the side, get that out of the way. And then next I'm going to take my chlorhexidine, and I'm going to do a target pattern starting at the middle and then going outward in a circular motion. Now I'm going to do the same with my alcohol. I'm going to do this 3 times for each. Okay, so now that she's been scrubbed, I can take my gloves off. I'm going to take my scrub jacket off so I don't bring in any extra, my jacket just broke. Any extra hair or decontaminants into the surgery suite. And we're going to detach her ET tube. We'll go ahead and bring her in on this towel so that the area stays as aseptic as possible. And then once we're in surgery, we will restrain her legs, and then we'll do the final scrub right before surgery. So Linda's going to start attaching the monitoring equipment. I'm going to tie her legs. And then we can get started on the final scrub leading into surgery. Alright, so now that we're waiting for the doctor to gown up and get ready for surgery, I can go ahead and start recording vitals and everything for the patient. So I have the patient's name, the procedure, which is a mass removal. The patient's a canine, I have the date, and I have the patient's weight here. So it's about 9:05, so we're just about to get a new reading for our blood pressure. But over here we have our SO2, our heart rate, our ET, CO2, and then our respiratory rate. So I'm going to go ahead and record that. So our SO2 is 99, which is good. So I'll go ahead and do that. Our blood pressure is 73. We have a little cheat sheet over here, so if I'm not sure or if I just don't remember, I can go ahead and check here. So he's about middle range, so you know his heart rate is a little bit lower for the smaller dog, but he's still okay as far as dogs in general goes. So we'll go ahead and put 73. have our ETCO2, that is 55, so that's a little high. We'll check that in a moment. And then we have our, it's a little hard to see, we have our respiratory rate. It's a little low, so I'm going to give him a few breaths and see how that helps. Our temperature is, looks like it's 99.9, which is normal, so I'm going to record that one every 10 minutes. And the rest of our monitoring systems, I'm going to record that every 5 minutes. Alright, so we're ready for our next reading. So we have our blood pressure. Our systolic is 129, our diastolic is 70, and then our mean is 100. If we look over here, looks like everything is within range, so that's good. So we'll put that down. And then our SO2 is 97%, so that's good. Our blood pressure, our heart rate is 71. It's within range for a dog. Go ahead and put that. And then our respiratory rate is a little low, so we'll have a few breaths to help it along. See if that helps. So we're at about 9 to 11, it's going up. And then our ETCO2 is 55. Those are all normal ranges. And then our temperature is 99, so we did drop a little bit, so we'll keep an eye on that, but it's still within the normal range. And we'll continue to just keep monitoring our heart rhythm. Looks good, so we'll keep an eye on that. Okay, so it's been about 20 or so minutes into surgery, so we're still in the process of, but this is what our anesthesia log looks like with a few readings. So each of these symbols corresponds with a different code down here. So as you can see, we're pretty consistent, and I've also been keeping track of our isoflurane level as well. So we'll be keeping track of that continuously until the end of surgery. So now I'm going to demonstrate how to perform a CPR on a patient. So first thing you want to do is you want to establish if the patient is in cardiopulmonary arrest. So you want to make sure that they are non-responsive, so that you can't wake them, can't rouse them, they won't respond to their name, anything like that. And then you want to establish that they are not breathing. So if they're non-responsive and they're not breathing, we can take that into account that they may be in cardiopulmonary arrest, and we can start performing CPR. So for a larger dog, what you would want to do is you want to take your two hands and place them over the thickest part of the thorax, which is around the 10th rib. And you want to go a little bit dorsal on that part. And you want to press down about a third of the width of the thorax. And you want to do about 100 to 120 beats per minute. And a good way to remember is to go about the by using the beat of staying alive. So staying alive, staying alive. So you would continue to do compressions like that. With a cat or a smaller dog, instead of going down right here, you're going to use one hand and go more ventral, where the heart is located, and press down with your thumb like that. And again, you're going to do 100 to 120 beats per minute. Next, while someone is continuously giving compressions, someone else should be checking to make sure that the airway is clear. If the patient has already been intubated, then you want to check the ET tube, make sure there's no obstructions there. If they have not been intubated, you want to go ahead and place the ET tube in lateral recumbency so that the person doing compressions can continue to do so. So we have our ET tube here, and we would go ahead and place the ET tube. Next, we would want to apply oxygen. So you can use an ambu bag, which you would use, it's a bag that you would press into and breathe for the patient. Or you can use an anesthesia machine, which I have right here. So when you're using an anesthesia machine, you want to make sure that you are making sure that the lines are completely flushed so that there is no anesthetic gas. You just want them breathing oxygen. So you would go ahead and attach the ET tube to the breathing circuit. Turn on the oxygen. I'm not going to do that for the purpose of this video, but you would turn it on, make sure everything is working properly. And then you want to do one breath for every 6 seconds. And while you're doing that, someone is doing compressions. And then you do 1 breath per 6 seconds, and that would be 10 breaths per minute. So now I'll demonstrate how to use an AMBU bag. This is how you would provide oxygen to a patient that is under cardiopulmonary arrest. Just like with the anesthesia machine, you want to do 1 breath for every 6 seconds for a total of 10 breaths a minute. And you can attach this to an oxygen mask that you can attach to the patient, or if the patient is intubated, you can go ahead and attach it to the ET tube, and this would be in the patient already. And then you want to take this compartment here and press down just like you would with a reservoir bag for 1 breath every 6 seconds. And you can attach it to oxygen, or it'll gather air from the environment to breathe into the patient. So now I'm getting ready to scrub in for surgery. So first thing I'm going to do is I'm going to open my pack up, and then I am going to start to scrub in. We use a rub-in product called AVMA. So per the instructions, I'm going to wash my hands with soap and water, and then I'm going to start applying the rub. So first I'm going to be very careful, do 1 corner at a time. And I'll leave that there. And now I'm going to thoroughly dry my hands and arms with a paper towel. So the AVMA has a foot pump, so I'm going to take my left hand, and it's going to dispense 2 mLs. And I'm going to dip my fingernails into the solution first and get underneath the nails there that way. And then I'm going to put the rest on my hands. So when you are scrubbing in, you want to imagine that your fingers, your hands, and your forearms have 4 sides to them, and you want to scrub them in individually. So I'm going to do that with all of my fingers. Side of my hand. My thumb. Palm of my hand. And the back. And then I'm going to get my forearm all the way up to my elbow. Okay, next I'm going to do the same thing for my left hand. So I'm going to dip my fingers in, get underneath the fingernails. And then I'm going to start on my fingers again. And then next, AVMA dictates that you do another scrub just for your hands and up to your wrists. So I'm going to go ahead and do that. And that's just to make sure we get all the Okay, so now that I'm all scrubbed in, I want to make sure that I keep my hands above my waist and below my shoulders, and I'm going to take my gown. So I have my indicator strip here that shows that it is sterilized, and I'm going to take this. I want to find the top part of it. Step away and let it unravel by itself. And I want to put my arms simultaneously through the sleeves, but I don't actually want to go through. So I'm going to keep them right in the cuffs, because we're going to do closed gloving. So someone will eventually tie the back. So next we are going to put my gloves on. Okay, so next I'm going to put on my gloves. So the way I'm going to do this is I'm going to take my left hand and pick up my right glove, and I'm going to have my palm facing upward, and I want it basically palm to palm, thumb to thumb, and I want the fingers facing my elbow. So I'm going to put this on. And as I put the glove on, I can start to get my fingers out from the cuff just on this side. Okay, so now that I'm all gowned up and gloved up, I am going to open our pack so that I can count the instruments, make sure everything is there that we need. Open that. Actually, I'm not going to use this gown, this drape that's right here. So I'm just going to put it on the side, and that'll stay there for the moment. So we have our gauze squares here. And here. So I'm going to count 25 at the end of the surgery to make sure that everything is where it's supposed to be. And in a stay pack, we have 18 instruments, so I'm going to count that. So everything is there. So I'm going to next take my needle holders and no, okay. And I'm going to wait for our circulating nurse to put a blade down. and then I'm going to load our scalpel handle. So that's how you know it's in place. So I've placed the blade on the scalpel handle, so I'm going to put that there for the doctor to use. I'll hand that to him later. And now that all of our instruments have been counted and accounted for, we can go ahead and proceed with opening the drape and draping the patient. So we have our hole already, so I'm going to go ahead and place our towel clamps. So the drape has been placed, the towel clamps are in place, so now the doctor can go ahead and begin his surgery. So now I'm going to hand the scalpel blade to the doctor, and when you're handing it to them, you want to have your thumb on the front, your index finger on the back, and you want the blade facing you. And when you pass it off, you're going to turn your hand.
Forceps, please. Gauze, please. Bets and bounds, please. Dab the surgical site, please. Stay hooked, please. Curved hemostat, please. Curved hemostat. Zero. And can you moisten my tissues, please?
so now that our surgery is done, what I'm going to do is go ahead and take a look at our tray over here. I'm going to count all of the instruments, make sure everything is still here and not, you know, like in the garbage accidentally or anything like that. So I'll go ahead, and there should be 18 again. And I should have prefaced that the fact that these sharps are already taken away. The doctor went ahead and put them in the sharps container, so everything here is safe to touch. And I'm going to go ahead and count my gauze squares, make sure everything is accounted for. There were 25 at the start of the surgery, so including the ones that we used, there should be 25 in total. Okay, so everything is in order, and then of course we have our saline that I used to wet the tissues, so that's there as well. And everything seems to be here, and we can go ahead and start the cleaning process for the instruments. So the responsibilities of sterile technician during surgery would include just maintaining sterility the entire time, passing instruments to the surgeon, and as well as managing and organizing the instrument tray or table, and then also you know, counting the instruments before and after the surgery, as well as the gauze squares or sponges, whatever you're using. And then you also want to, you're in charge of retracting and moistening the tissues and maintaining hemostasis throughout the surgery. In order to maintain sterility, the sterile technician wants to always be facing the sterile field. They never want to turn their back to it. If they have to move, they want to step away from the sterile field for a safe distance and just remove themselves from the area so there's no contamination. If by any chance there's a punctured glove, or if the gown is contaminated, then the contaminated person, whether that be the surgeon, the sterile technician, what have you, would want to remove their gown or glove, whatever was contaminated, with the help of the circulating technician, and they would take their gown inside out, and then same thing with their gloves, and then re-gown and re-glove. They don't have to re-scrub or anything like that. If a instrument is dropped, then it should be inspected for damage by the circulating nurse, and then it should go through the flash sterilization process before it can be used again. Okay, so we have our canine neuter here. I'm going to go ahead and open the pack for the doctor, and then I'm going to scrub the patient so that when the doctor comes in, the patient is all prepped. So I'm going to open our pack. And then I'm going to take our 10 blade out. Carefully drop that on there. First scrub is going to be just getting rid of like all the excess debris on there and putting the hairs out of the way. And then our next few scrubs are going to be done aseptically, working from the middle and going out. Make sure I get the testicles as well. One more. The patient is ready for the doctor to start the surgery. So now I'm going to help prepare for a canine stay. So the first thing I'm going to do is I'm going to open the surgical pack for the doctor. And I'm going to drop a number 10 blade onto the pack. now I'm gonna clean the area, scrub the area. First scrub is gonna be just to get rid of all the excess hairs on there. Just put everything down. Now I'm going to scrub the area in a circular motion 3 times. Now it's ready for the doctor to make his incision. So we're getting ready to do a cat and neuter. So what I'm going to do is I'm going to open the pack for the doctor along with his blade. And then I'm going to scrub the testicles and incision first. I'll leave that there. And I'm going to drop the blade side. I'm going to come over here and I'm going to scrub the area. And then once the doctor is ready, he can begin his surgery. So now I'm going to help prepare for a feline stay. So first thing I'm going to do is I'm going to open our pack for the doctor, and then I'm going to scrub the patient. And I'm going to put out a number 10 blade. Just drop that right there. This. I'll let the doctor go through so he can start setting up, and I'm going to scrub. The first scrub is just going to be to wet all the hairs down. And the next scrub is going to be in a circular motion. More, and then the doctor can start his incision.